So I'd like to introduce today's presenter. It's Ron King, the CEO and founder of Vanguard Communications, a healthcare marketing and PR firm that has helped doctors promote their practice and manage their reputation since 1994. He's also the author of the book, The Totally Wired Doctor, Social Media, the Internet, and Marketing Technology for Medical Practices. During today's Pathways to Prosperity webinar, Ron's going to be presenting on how to improve online reviews for doctors and medical practices, focusing on why online reputation is important to business success in healthcare, as well as what preventative measures a practice can take to guard against bad reviews. So without further ado, Ron, if you want to take it away.
Thank you, Stephanie. So we hear a lot of talk these days about online reputation. What does it mean? And especially what I hear from a lot of medical practices and physicians is, how do I fix my reviews? Well, that's a great question. So I want to talk about it less from going back and fixing something and more from the standpoint of preventing something. So that's why I want to talk about vaccination instead of exasperation. When you get a bad online review, it's exasperating. It's easy to avoid them, however, by vaccinating against them. So first of all, let's talk about why we should care about online reputation management, and after that we're going to get into your choices for how to deal with bad reviews online. And then I want to talk about the half full glass. This is actually not as hard as a lot of people think, and there's a lot of reason to be optimistic. Fourthly, we're going to talk about some of those internal vaccinations you can do within your own medical group or practice to guard against reputation attacks. And then lastly, the real meat of it, I think, is 5 steps for building reputation. So without further ado, let's define online reputation management. Basically, it's defined as influencing perceptions created on third-party websites. These are the big 4 these days that we spend most of our time dealing with, and there's some others that we work with to some degree, but the vast majority of patient reviews are on these 4 websites, and these are the ones that we really work with on a regular basis. Now, who pays attention to them? Good question. The accounting firm PricewaterhouseCoopers has done a study, about 1,000 different Americans, and what they poll actually of 1,000 Americans, and what they found was that about 48% of those people read healthcare reviews, and that equates to about 150 million Americans. About a fourth of them, 24%, have written reviews online, and more than 2/3, 68%, have read the reviews online in making healthcare or other purchasing decisions, and that equates to about 102 million people. So a lot of people are paying attention to these. It's pretty important. Now, the Pew Research Center is a fountainhead of information about the internet usage in regards to healthcare, and they find that about 3 in 4 people go online for healthcare at least once a year, healthcare information. About 3 in 4 also start a search engine, and about 13 of those percent, actually only 13%, I think is the operative word here, about 1 in 8 really started a medical specialty site like WebMD. They actually tend to go more to search engines. So search engines are very important. And according to the Pew Research Center, the numbers are a little bit different. They say a little less than 1/3 have consulted online reviews. Only 7% have posted them. 26% have read or watched somebody else's health online, sort of vicariously. So you can take this as the lower number, and the PricewaterhouseCoopers as the higher number. In both cases, though, it's a lot of people. These are important. Well, most importantly, perhaps, beyond the people who are watching online reviews, is search engines. If you Google a practice name or a doctor's name, here's what you'll find in many cases. In the results page, and the search results page on Google or another search engine, you'll see that the practice website will typically be in first place in what we call the organic listings. These are the non-advertised places. And then right down the page there is a bunch of websites for rating your doctor. And here you have a real practice in California, and on the first page, 3 of the top 10 reviews are websites for rating your doctor. And you can see right away they have the number of average star ratings that practice has. So that makes an immediate impression on someone who's maybe looking for a new doctor. They can see at a glance how well this practice is generally regarded out there on the internet. So this is really important because this is a first impression that cannot be reversed. Search engine is very important. What's not so important is something I see that's a little disturbing out there. There are a lot of companies, many of them, dozens if not hundreds, that are selling what I think is a little bit of a magic elixir. They want to make sure you have monitoring software, which can be useful in some circumstances, especially for larger organizations, perhaps larger hospitals, larger national networks, or perhaps statewide networks. But for the most part, smaller hospitals and medical practices, certainly independent ones, don't really need this kind of software, and I'll get into that a little bit later in this presentation. So beware of the thought or the idea, the easy notion, that all you need to do is buy some fancy software and it'll help you fix your online reviews, good or bad. So a little bit of a side thought there. Instead, we want to talk about prevention. How do we stop so many reviews from being negative or critical, and how do we conversely improve the positive reviews? Well, there are three prevention strategies that we are very confident in here at Vanguard Communications. One is that you will always have unhappy customers. It's a fact of business. For those people, you want to deal with their complaints privately. You want to try to manage them before they go online and it becomes public. The second strategy, of course, is to respond quickly when there is a public complaint. And then the third one is pretty obvious. You want to encourage online praise. If you're good at what you do, and most businesses are, certainly most providers, healthcare, and others, have happy customers. We want to encourage them to go online and tell others about it. So those are our three strategies. Pretty simple, right? Now, this is what some physicians are doing instead. A little bit discouraging. They're suing some of their patients who said nasty things about them on the internet. I understand the feelings in many cases. In some cases, they're not even real patients who are doing these reviews. And in some cases, it's many, many extenuating circumstances that the physician or provider group cannot get into on the internet. It's unfair. This is not a fair system. Let's say that at the outset. Online reviews are not scientific. They're not just, but they are real. So we have to deal with them somehow. This is one way to deal with them, is to sue the people who say bad things about you. Well, how do they do when they sue the patients, when doctors sue patients? As you can see, it generates a lot of press, so I don't know that that's necessarily what they want. We have an expert in this field in California, Eric Goldman, who is with the Santa Clara University School of Law, who's done extensive study in this area. Very interesting findings. He's gone through and researched cases of doctors suing patients, and here's three samples. And if you kind of run through his summary here and on the next slide, you'll see the plaintiffs, the doctors who were reviewed poorly, don't do very well when they sue. Their cases are routinely dismissed, or in some cases they're settled out of court. But there's very few instances of doctors or anyone prevailing in this kind of lawsuit, in so-called defamation lawsuits. It's a very difficult area of the law. And particularly for online reviews, the courts tend to favor free speech quite a bit. So suing doesn't feel like a great way to respond to these reviews. Now, for some insights into this, we did a study in 4 cities of 2 specialties, family medicine and, I should say, internal medicine and OBGYNs. We found physicians with 1- and 2-star reviews on these 3 websites in these 4 cities, and found 3,617 of them had 1- and 2-star reviews. So we went through and evaluated all those one by one, by hand. Here's what our rather surprising findings told us. Only 1 in 8 of all the physicians in those 2 specialists had 2 stars or less. So it's a very small minority of people, physicians who are low ranked. Of those with 2 stars or less, 43% of them were reviews about doctor indifference in bedside manner, nearly half. 36% of those 1- and 2-star reviews complained about customer service, and 19%, or about 1 in 5, said they would not go back to the same doctor. Pretty interesting. 1 in 5 people were so upset they would never return again. So if you do the math here, what you find is about 1 in 5 people are concerned about the doctor's or the provider's real clinical skills. What really upsets people is bedside manner and customer service. And I got to tell you, if you want to entertain yourself on a cold winter night sometime, go online and read some of these, because there's some really entertaining comments here online. And here's a sample of some of them. It made for a very interesting and fun research project for our staff. So you can see bedside manner is everything. Just even a physician's appearance or a PA or a nurse practitioner's appearance can say a lot about the kind of care that patients feel they're getting. Customer service was a very, very common problem in our research, and it is elsewhere throughout the online reputation world. Many people complain about the staff's poor customer service, and of course about the physician running behind schedule. So these are things that really matter. I think bedside manner and customer service. Quality of care in our survey was only 20%, about 20%, 1 in 5 of the cases. That means 4 out of 5 times people are upset about not whether they're getting taken care of in a good way clinically. They're getting complaints about, they're making complaints about whether they're being handled in a customer service fashion that would make them want to come back. So, bottom line here, the patient has a lot of choice here, has the ability to express his or her opinions on the internet. It's a democracy after all. The patient has a voice and the patient has a choice. So I say, like it or not, there's a lot of power to the patient. So, what this is all about is not about computers, not about software, it's not about how the internet works or social media or any of those things. It's about customer service. Let's get into, though, what is the starting point for this, which I think is pretty good news to hear. Let's go through a few facts here. Here's some other studies. The Journal of General Internal Medicine surveyed 300 Boston physicians and found 190 doctor reviews and 33 websites. Look at this, 88%, nearly 9 in 10 generated positive reviews. Only 6 were negative and 6% were neutral. That's a pretty small number of complaining people, unhappy customers. This is their conclusion. Physician rating websites offer patients a novel way to provide feedback, and a majority of reviews appear to be positive. So, what is all the fuss anyway? DocSpot, a website, did a survey of nearly 250,000 reviews, same kind of findings. About 2/3 of the reviews gave the highest rating possible to their healthcare providers, and 3 or 4 of the reviews gave the doctors positive rankings. Interestingly, chiropractors got the highest rankings and endocrinologists rated the worst. A side note there. But the takeaway here is that people are mainly happy with their healthcare providers. I would say probably much more so than they are with other services out there on the marketplace. And this is what we found in our review. When we analyzed the words of the reviews in those 3,617 reviews, we found that the words most often mentioned in order in those reviews were staff, office, and time. Care was number 8. Once again, confirming care is not the issue, it's customer service. Now, some practices are very thin-skinned about this, and there's a movement to actually prevent patients from reviewing their physicians online. And this is what some doctors and other providers are actually asking their patients to agree to, that they will not review their care in any way once they've received treatment. And I'm not too sure I know of anybody who would be willing to sign that very happily. So I don't know that that's a great way to do it. There is a website called Doctored Reviews that provides an alternative. This is also a joint project between Santa Clara University and several other institutions, and I think it's more the way to go. Their position is, why should you have any less information about your doctor than anything else you can buy out there on the marketplace? And furthermore, they also say, what doctor doesn't want your feedback? Do you want to see that kind of doctor? And thirdly, would you trust a physician or a provider of any kind who predicates your care on your silence? I don't think I would, and I doubt very many people would at all either. So, I think the point here is that we can really harness the power of online reviews. Rather than asking patients to sign a gag order, the founder of the healthcare blog on DocSpot posits, doctors should be asking their patients to fill out online reviews. I'm completely in agreement. I think you get a lot from online reviews to benefit your practice and patients. So let's talk a little bit about two ways to make the most out of those reviews, internally and externally. First, internally. There's some no-brainer things to do to really boost your reviews right off the bat. One is to be a culture where your entire organization is watchful, responsive, and preventive. Now, traits of a watchful culture. This means that all staff are trained to give patients full attention, including looking them in the eye. Participating in active listening skills, being very good about what they're hearing from patients, being attuned and on the watch out for signs of dissatisfaction and satisfaction, of course, and knowing when to escalate a problem to upper management. Sometimes we just have people who can't be happy, customers who can't be happy, and we have to deal with them somehow. In a responsive culture, the staff is provided written guidelines for what to do and say in almost any conceivable situation, particularly one that might escalate into a problem. They are given deadlines for returning patient calls, for responding, for answering concerns, and so on, whether it's 24 hours, 48 hours, 5 business days, what have you. And they are trained also to have basic abilities to de-escalate tensions. Don't take things personally, but really work to calm the dissatisfied customer. And lastly, knowing when to kick things upstairs when they're a problem. In a preventive culture, everyone greets staff, greets callers, visitors, emailers warmly. They ask habitually, what else can I do for you today? They keep their chit-chat out of the earshot of patients. They avoid making excuses for when things go wrong, especially blaming it on a patient. That's a very good preventative culture. Other traits would include a live human answering the phone. I know this is sometimes practically not possible, but something as an alternative to just voicemail during business hours makes a very strong impression on patients. Dress is very important, dressing professionally, apologizing to patients when there are delays. Doctors get behind, everybody knows it. All most people want to hear is a simple, I'm sorry. Following up on your promises, on your communications, and so on. And lastly, embracing the idea that healthcare is a service profession. It goes all the way from the bottom to the top of the organization.